Mvuyo Mkhasi, the NICD's Cough WatchSA Study Lead. Mvuyo, good afternoon, and thank you for joining us live in studio. Welcome.
Good afternoon, Lulu. Thank you for having us here, and also good afternoon to your listeners.
Now, you know, when we talk of influenza, we just normally call it a flu. You know, I've got a bit of flu or a bit sniffly and things like that. Tell us about the 2024 influenza and how it affects the citizens.
Think of common colds. When they think about flu, it's a cough, they have a fever, they stay at home. But the only way of knowing what type of respiratory illness you have is if you have a test, right? Because you could have bronchitis, you could have bronchiolitis, you could have influenza. So these are different pathogens that cause similar kind of presenting symptoms. So for 2024, each year we do expect seasonal activity, which means around the winter season, starting around April towards end of May, we see a rise in influenza-like illnesses from the population. And how we identify this is through surveillance programs that we run. So we have a network of public clinics and hospitals across various provinces in South Africa, where we've got nurses who screen patients who present with similar kind of symptoms. We then collect respiratory samples to test for influenza and two additional pathogens, which is SARS-CoV-2 that causes COVID, and a pathogen called RSV, which is respiratory syncytial virus. So the season has started already for this year in terms of influenza, and this was around the 22nd of April, where we saw an increase in the number of cases that have crossed the benchmark threshold that we use to compare and determine if the season has started or not. So at this stage, it's too early to determine if we have a more severe influenza strain that's circulating. We can only make that determination towards the end of the season, but we are seeing an increase in cases, and it's important for people to be alert and protect themselves. And the most effective way currently is the influenza vaccine that people can take, and obviously non-pharmaceutical interventions. So hygiene practices, wearing of masks, and staying at home if you are not feeling well.
So I note that as the NICD, you basically stated that the season seems to have started a bit earlier than usual.
Yes.
Climate change, is this part of the impact, and what we're seeing, the weather patterns being different? Could this be part of the cause?
At the moment, it's we don't know if we can determine that as yet. We still need to have more data to make that determination. And also we note that we are still coming out of the 2020 COVID pandemic, right? And we don't know what shifts may be introduced in terms of the patterns that we are seeing. But what is still typical is around the flu season. So we are in April, May period, and the 22nd of April is typically an early period to declare the flu season. However, last year we declared it at the same time. So we might be seeing a pattern going forward that April might be the period where the season is declared, but we'll need more data to make that determination.
And speaking of last year, in terms of the differences, looking at the influenza currently and its impact, what are the differences, if any, and what are the similarities, and which one was seemingly a bit more hectic than the other? Last year you probably have the data, but this year you're still putting together the data. But early signs, as the experts, you have some sort of signs to show that there is going to be a huge difference, or it'll be the same.
It's very difficult to determine that because what you can determine is the start, where okay, now we are in the season. But the way the epidemic evolves, it really depends on the strain that is circulating. So from last year's strain, and the reason why we do surveillance work is that we use the confirmed strains to contribute to the influenza composition for the next year, so that the next year's vaccine is well matched to what might be circulating this year. So the shot that is the vaccine that's available this year was based on the strains that were circulating last year, and this is compared with other regions in the southern hemisphere to ensure that we can improve the effectiveness. So at this stage, all we can do is monitor the number of cases. We can look at the analysis on burden. So how many people were hospitalized, how many beds were required per facility. So these are the kind of data we can only do towards the end, and only at that stage compare with the impact from last year.
And who are the most vulnerable group?
Absolutely. So I'll start by the stats first. So in South Africa, we have about 3 to 5 million symptomatic cases of influenza annually, and over 11,000 deaths that are due to influenza-related illnesses. And the biggest vulnerable group are children below the age of 5, especially newborns and those below the age of 1. Pregnant women, including those postpartum, are also at higher risk of severe illness. The elderly, those who are above 65 years old, and then those with underlying medical conditions are at increased risk of having complications due to influenza. And this is why those groups it's important for them to seek vaccination so that they can minimize the outcomes in terms of severity when it comes to influenza.
Now, as the NICD, you're encouraging eligible people to partake in a study known as Cough WatchSA. Tell us a little more about Cough WatchSA and how it's going to work.
Yes, so Cough WatchSA, it's what we call a participatory surveillance program, where members of the population can sign up and report on a weekly basis the absence or presence of respiratory symptoms. The reason we're doing this is to address the challenges that we have with our current sentinel surveillance. So we have published data that 25% of symptomatic respiratory illness is non-medically attended, which means we are missing a significant proportion that seeks other forms of care. Because we run surveillance in public clinics and hospitals, we also have a network of private GP consultations, we are then missing a substantial proportion of cases. This leads to underreporting. It also leads to an underestimation of the community burden of respiratory illness. So Cough WatchSA now extends the data collection directly to members of the population by asking them to report on a weekly basis if they've had a respiratory symptom or not. So this is a decentralized platform that does not require or rely on people seeking medical care. And in that way, we get a complementary data set that we can use in conjunction with sentinel surveillance to improve the disease estimates and the community burden of respiratory illness. And how it works, it's a web application where people can sign up on the platform. And then there are two main questionnaires. The first is what we call an intake questionnaire. This is basic individual characteristics, so demographic data, any underlying conditions they might have, and then seasonal influenza and COVID-19 vaccination histories. Then on a weekly basis, there's a symptoms questionnaire that we send out to participants. And the very first question is, have you had respiratory symptoms in the previous week? If it's a no, it counts as a successful submission. But if you have experienced those symptoms, we ask you which symptoms specifically, and then the onset of those symptoms, when did they begin? And then a series of follow-up questions in terms of care seeking, and if you've had any tests related to that illness, and ultimately any impact in terms of school or work, looking at loss of time. So we get to conduct the same analysis from a sentinel surveillance, but it's relatively low cost and it's participatory. Anyone can sign up who is 18 years and above, and it's more nationwide. So you improve the estimate in terms of your reporting and the insights that you can get, especially from the non-medically attended cases, which we are unfortunately missing from our surveillance.
When you say low cost, what sort of cost implications are there, or is it just free in terms of the app or downloading it? Talk to us on that.
So from an implementation side, the cost would be around developing the web application and running the communications and ensuring that the platform is operationalized. But from an end user perspective, the platform allows participants to get a reimbursement for using their data to access the survey. Okay. So if you submit successfully a symptoms questionnaire each week, you qualify to receive 10 Rand airtime voucher of the provider of your choice. And the data usage is really, really substantially low, considering other applications like, your streaming platforms. So there's essentially no cost to the user because they get back whatever it is that they use. But also there's a benefit in terms of participation where we are running an incentive. If you have submitted 4 symptom reports in a month, you are eligible for a cash prize worth 1,000 rands, and 8 lucky winners each month will be receiving these prizes. So we are trying to incentivize participation. we require consistent participation in order to make the valuable insights, and the reimbursement and the incentive is a way of ensuring we increase the numbers and get more people reporting so we can have more data to provide insights.
Now, in terms of timeframes, what are you working on? When does it all start, and when is the end date for getting all the data together, and then being able to collate it and put it out there to the public?
Yeah, so the first is that the study runs during the flu season. So we're running it for 6 months. So from April up until the end of September. If we are seeing from our sentinel surveillance that there's still influenza activity, we might extend it towards October. The reason we're doing this is to allow us to compare the reported trends from our sentinel surveillance, and ultimately in building this as an early warning system, we need to be able to validate that what is reported is consistent with what we're seeing from a medical care seeking perspective. And the second thing is we will be issuing monthly surveillance reports that show the trends in the reported data. So we'll provide vaccine coverage rates, and we can provide this by age group. We can provide the total number of suspected cases for influenza-like illness, and we can aggregate this by region so people can search either at a provincial level or a district level, what is the influenza reported activity looking like. So there is a monthly reporting component in terms of the data, and then 6-month period in terms of running the study, so we can compare overall the influenza season between sentinel surveillance and the reported data.
And I guess with people wanting more information, they'd be able to go onto the NICD's website to get these details. What else can you tell us?
Yes, so this is a web application, and it's www.coughwatchsa.org.za. And like any website, we do have editorial content, we do have frequently asked questionnaires, and from the first week of June, we'll be issuing our very first monthly surveillance report. And then on our NICD social media pages on X, NICD_SA, on X, and then the National Institute for Communicable Diseases, both on LinkedIn and Facebook, we do post regular updates around Cough WatchSA. Not only that, but on our website, the NICD website, we do have weekly respiratory pathogens report that show the data from our surveillance activities. So you can see how many patients have sought care at public clinics and how many have been hospitalized, how many have been confirmed with influenza. And this data will help to show the activity around the season, and bringing Cough WatchSA on board is now bringing in the decentralized aspect with community volunteers basically on the platform.
Mvuyo, it's been a pleasure having you in studio. Thank you so much for joining us. We could have gone on and on and on, but we've run out of time. And a lot coming up. That is Mvuyo Mkhasi from the National Institute of Communicable Diseases, Cough WatchSA, joining us on the line. You've got the details, he's just mentioned them on air. And thank you so much for joining us live in studio.
Thank you for having us.